Thank you, Mr. Chair. I will be splitting my time with Mr. Callaway. I thank you also to our witnesses for joining us today and sharing their perspectives and the expertise on this, what I believe is an incredibly important topic. Dr. Lavoie, I was taken aback a bit by knowing that only 10% of the population is aware of the Wellness Together. And when I see that 680,000 Canadians have already used the service with close to 1.8 million separate web sessions, it really does give me an important scope of and a scale of the crisis that we're facing with. So I appreciate you bringing that forward, and we need to find ways to make sure that more people are aware of that program. I will be asking my question to Dr. Sareen. Dr. Sareen, since the beginning of the pandemic, it's become clear that COVID-19 impacts certain communities disproportionately, that race and gender and socioeconomic status are some of the factors that can amplify these impacts. So based on your experience with the First Nations communities, could you please share with the committee some of the mental health effects and the challenges that Indigenous peoples are facing as a result of the pandemic?
I think, so some of the key things are what every Canadian is facing, which is, fear, anxiety, stress. The additional barriers, if people are living on reserved communities, is that having poor access to sites in urban settings. Stigma is also there, and if somebody's had COVID, we know that having COVID right now increases stigma for all people that have had COVID. And people, so there's more stigma and discrimination that can be also faced. I think, coming back to Dr. Lavoie's point, I think many people are scared to get care for chronic health conditions unrelated to COVID, and that can also have a major impact on, as far as mortality. And we know our First Nations communities have significant health disparities. So people are less likely to come for appropriate care, and we really have the tools to be able to provide telephone, video conferencing assessments, and we really need to do that so that people can feel safe to access care in their home community.
Thank you. When you appeared before the committee in 2017, you mentioned you were working on a team of researchers that were examining the impact of trauma and PTSD among Canadians. So the current COVID-19 pandemic has taken a physical and emotional toll on many people in Canada and across the globe, and particularly on our healthcare workers and first responders whose jobs have been essential during this pandemic, but also more demanding and emotionally draining than usual. Do we currently have any research that shows the impact of the pandemic on their mental health and what can be done to support those on the front line?
So there are groups that are working on understanding the health impacts. We know that healthcare workers, as well as first responders, are at higher risk of developing mental health difficulties because of their daily stress, as well as seeing the traumatic events. So there is work that is being done to look at those interventions. And then we have also developed in Manitoba prevention trials, where we are providing a randomized trial to look at cognitive behavior therapy to reduce depression and PTSD among public safety personnel. So that's a trial that we've been doing because it's really important to try to prevent mental health difficulties in our populations.